Hey, everybody. Good morning. Good morning. Good morning. And welcome to Invisible Condition. It's not all in your head. I'm your host, Jeff Pearson, and we want everybody with an invisible condition, no matter what that condition is, to know beyond the shadow of a doubt that you have a voice, you do have a community, and you are never, ever alone. So, uh, here on Invisible Condition, we understand that some days, some days are better than others, right? Some days can be tough. I get it. I can totally relate. I mean, for those of you that have been watching for a while, I mean, the condition I was born with, I'm 7 brain surgeries in. There's some crazy days, right? We also know, though, at the same time, that there is always hope. There's always hope. So if you are in a place where you're like, well, where? I don't see it. I don't know where my hope went. Shoot me a message right here, jeff@hydrowithhope.com, and just put the word hope in the subject line. I would love to help you with that. So, all right. Now, let's see. Okay. Yes, we are. Nope. I'll talk about that more later in the show. Today's guest, I'm very excited to introduce you to today's guest. She is someone who understands what it's like to live to live inside a body that doesn't necessarily follow the rules like everybody else. I get it too. Mine has been kind of like that too for a while. Dr. Keeli Gailes is a doctor of physical therapy specializing in hypermobility disorders, POTS, most cell activation syndrome, mast cell activation syndrome. There's a mouthful, and pelvic health. So, a lifelong dancer who once saw her flexibility as a gift, like later, hypermobility, man, that can really rock your world. As somebody that was a dancer, later realized that the pain, fatigue, and unpredictable symptoms that she was managing every day weren't random. They were connected. Like so many of these conditions are connected, and people don't realize it. And that's why I'm so glad we're doing this show, because this is going to open some eyes here. Now, through her clinical work, and she's got a really cool program called Bendy, Dizzy, Itchy 101. We'll put that on the screen. The QR code that we put on the screen in a minute will tell you can go there and learn more about that. And her nonprofit, Health for the People, through those, she's helping patients and providers finally connect the dots and feel seen and supported and empowered. So let's bring Keeli on the show and hit the ground running here. Let's see what we can talk about. Keeli, thank you so much for being here. This is going to be awesome.
Hi, Jeff. I'm excited to be here.
This is going to be so cool. And you are coming to us from outside the country. Tell it, where are you again?
Yeah, coming to you live from Belize.
From Belize. Awesome, man.
Can you believe it?
Yeah. Sorry, go ahead.
Said, can you believe it?
I mean, in this day and age, with the connectivity that we have in this world, I do, but at the same time, it's kind of cool. You're like, okay, so this is life and times of Keeli and Belize. There you go.
Fun fact about Belize is we're in the central time zone. A lot of people think that because it's not in US, it would be in some weird time zone, but just in the central time zone.
Yeah, we're only an hour apart in time. Like I think about that too. Like I've done shows with people on every continent on the planet over the last 3 years, and I have had some crazy time differences from Australia to South Africa to it's crazy. So this is actually kind of cool. Yeah, we're only an hour apart here, so this is great. So I do have one question that I like to ask everybody that I bring on the show. There's no wrong answer. In fact, every answer I've gotten so far for the last however long I've been doing this with this question, it's always been awesome. So on the tough days, because we all know there's tough days, on those tough days, how do you still maintain hope?
Hmm. Well, Jeff, I would say that I was born a serial optimist. So that's very helpful in maintaining hope. And sometimes my downfall, I'm notoriously optimistic. So I've rarely struggled with finding hope for myself. A lot more often, it's been trying to help those around me find hope. Uh,
Mm.
and I've constantly been a glass half full girl, for better or worse. But yeah, I would say that I just know that tomorrow's going to be different, and that's how I look at it for myself and how I look at it for all of my patients. The nice thing about these conditions that we're going to be talking about is that every day is different. So even when you're having a terrible day, there is hope that tomorrow might be much.
Right? I love that answer. That's perfect. And I totally can resonate with that for sure. Yeah. It's for a while there over the last 10, 12 years and 4 brain surgeries, there've been days like that too. It's like, look, today, it was like, oh, well, today it's this weird thing going on, but don't worry, tomorrow will be something different. That'll go away and something else will show up. So it'll be cool. It'll be fine. So,
Working as a PT, I think has been really helpful too because really puts my symptoms in context for me. And I am very grateful because I know that I am not nearly where I could be. And so I'm grateful every day whenever I'm having issues. They seem like small change, and I'm more grateful that I understand how to impact them to help myself feel better.
yeah, totally. Yes, yes. And I'm sure that I want to acknowledge the audience for a second too, because I'm sure that some of the things that we're going to talk about today are going to resonate with somebody in the audience. We've got lots and lots of people watching. And so welcome everybody from TV world and TV land and Facebook and YouTube and E360 and Apple TV and wherever you're watching. Thank you for being here. We're so glad you're here. And if you are on Facebook or YouTube watching, really, really cool because you can actually participate today. You can, if you want, and we totally encourage it. We highly recommend that if you hear Keeli say something, or me say something, or something in the conversation, sparks interest or a question, just throw it in the comments, man. Comment with a question or comment with a comment or whatever, and just let us know. And then we'll get back to you. We'll let you know. We can answer you back and kind of interact a little bit. So please definitely, let us know what you're thinking as things come up while we're talking. And then also this QR code is gonna lead people to your website, your page that's got some really cool resources. And so what just briefly, what resources are you going to find there?
Yeah, so this is going to take you directly to the Bendy, Dizzy, and Itchy page, which is part of the Health for the People organization. And this gives you the background on what is this program that I'm talking about, how do you sign up for it, what is the cost, my background if you wanted to look more into that, kind of what is the organization as a whole. But you can get the details. So if you want to sign up, you can do it directly there. You can pay there. You can schedule your first session.
Beautiful. Love it. All right. So that's going to stay there for the majority of the show. If we go talk to sponsors or something, I might take it down, but it'll stay up there so that everybody can scan the QR code and check out what you're doing. So let's dive in here. Growing up, I mentioned in your intro that you were a dancer and someone who was just, naturally flexible, probably as a dancer. Our youngest daughter was in gymnastics for like 10 years. Like now she's a cheerleader. So you and her are like cut from the same cloth, man. She's flexible too. It's kind of freaky to see what she can do. It's kind of, how she can bend her body. But when did you finally realize that something was going on there, that there was something unusual going on?
Yeah, I'll be honest, I didn't connect the dots right away. So I first started having some mild symptoms, I would say, as early as high school. I would stand up too fast and get a little lightheaded and starry and then sit back down and be fine. So I just would move on with my day. I started having to take B12 injections when I was giving myself injections when I was in high school, taking iron supplements in high school. Didn't think anything of it. Had a foot injury in high school and a shoulder injury in high school. That just all seemed like, people get hurt, right?
Sure.
And then I made the decision at 17 that I wanted to be a physical therapist, and I'm a little stubborn, and so I stuck with it. But I started out my training as an athletic training major because when I was 18, started shadowing a PT because I'm a go-getter. And so my whole summer in between high school and college, I was observing and doing like free, I wouldn't say community service, but observation hours.
Sure.
And the PT that I was shadowing told me that's how he got his start. And he thought that it was really helpful. So I went to athletic training school. I got my degree in athletic training. And during that process, I started understanding the body and how it moves and how it works. And I think maybe one slide in one lecture, one class, they said, oh yeah, and sometimes some of your female athletes will be hypermobile, and this is what it looks like, and they're going to be really skinny, and they're going to hyperextend their knees, and it can cause problems, and just know this is a thing. It's called EDS. I was kind of like gone, right? And I went,
All right.
Well, that looks a lot like how I stand, and I don't have, like a ton of problems yet, but that's interesting. Like, I think I might be hypermobile.
And so
that
you said hypermobile, but then you said EDS. So hypermobile, what is HSD, right? Hypermobile.
Yeah. So at this time, back in the way backs, they didn't have the same designations that we use now. Okay. So you either had Ehlers-Danlos syndrome, which is when you hear me say EDS, I apologize. That's that one, which has multiple types. There are 13 different specific types that you can have, and the only type that is one, the most common, and two, thus far we have not had a genetic marker for it, but there is ongoing research right now. There's a couple that we think probably are going to be the markers for it. There just hasn't been enough research to say for sure, but is the hypermobile type. Something like 80 to 90% of people who have EDS have the hypermobile type. The good news is that people who have the hypermobile type have much lower risk of more serious concerns. So other types, such as classical and vascular EDS, are more concerning. And so I think that's where historically the medical community put all of their efforts and their understanding. And so if you didn't look like classical EDS or like vascular EDS, they were kind of like, well, you're not going to die. So
suck it up.
They're just extra flexible. You're fine.
Yeah.
And I want to be careful when I say this because there is, the pendulum always swings, right?
Yes.
So at that point in time, there was very little understanding of hypermobile type, and there was a lot of discounting that it mattered or that we should be diagnosing it or treating it with care. Yeah. There in recent years has been a lot of education around the hypermobile type, especially since more and more people are recognizing that they do have this, or HSD, which is the same spectrum. It stands for hypermobile spectrum disorder.
Okay.
Which essentially means you meet most of the criteria for hEDS or hypermobile type, but you may miss one or two. From a PT perspective, I treat HSD and hEDS very, very similarly. So that is why I use terms like bendy, dizzy, and itchy, because when I'm doing coaching, I'm often working with people who may or may not have a diagnosis. And so I am not here to diagnose you. I just want you to understand the tools that are going to be relevant, and they kind of fall in these 3 buckets.
Mhm.
And not everybody has all 3 buckets, but most people who have one have at least one other of them, not
Yeah.
in all cases. Okay. So back to me and how I got there, right? I started my degree, I learned I was hypermobile, and then didn't really think much more. But I started having back pain. I started having more painful menstrual cycles.
Hmm.
And then I graduated, and I wildly ended up living in Alaska because I'm an adventurous
Sure.
spirit.
Why
And
not?
I was working 3 jobs. I have family there, so it wasn't completely out of normal. But um, and my back was really bothering me, especially when I was waiting tables.
Mm,
Well, one of my jobs is I was a tech at a PT clinic because I knew I was going to PT school.
sure.
So I had a PT assess my back because I mean, it had been going on for years, but it was getting to the point where I was having a hard time making it through the shifts.
Yeah.
And they basically looked at me and said, "You have full range of motion, you have full strength, you're young and healthy, shut up." Like, he literally said, "When you stop waiting tables, your pain will go away."
uh,
And I was like, "Thanks. Well, I
uh,
have a couple years still probably before I can even start PT school, and then a few more years before I can, work. So
yeah.
what am I supposed to do with that information?"
Right.
Um, I was very fortunate that he was not the boss, and I told my supervisor about my experience, not experiment, and she said, "When I come into town, I'm going to reevaluate myself."
Good.
He was the first provider who looked closely, listened closely, and understood that just because you have full range of motion and just because you have full strength doesn't mean there's nothing wrong.
Yeah. Yeah.
And she was able to help my back pain go away, right? And
Nice.
granted, I'm like 22 at this point. I'm still
Yeah.
fairly young, right? Um, but that was, I think, my first experience with, oh, we're like, I'm getting gaslit, and I have a medical background, and I kind of know some stuff, don't know everything, right? But like, if I can't advocate for myself or
Right.
get adequate care, then how is anybody who doesn't have at least a bachelor's already like sports medicine? So
But that shouldn't even be exclusive. I mean, anybody should be able to advocate for themselves. I mean, that's one of the things I stand up for all the time on this show and when I'm speaking in front of a crowd or wherever. Like, I wouldn't be here if I didn't stand up for myself and advocate for what was, I mean, hear me, everybody. You are your own best advocate and you live in your body and nobody else does. Right. So, yeah, yeah. Just because just because he or she has a white coat on and a stethoscope around their neck doesn't mean they know everything. Okay. They're just practicing sometimes. So,
I love that.
uh, that's why they call it practicing medicine. They don't know everything. So, yeah.
But it's
Um,
funny, it's something that made me remember. I skipped over one of my first bendy issues is that my shoulder got dislocated as a kid.
oh,
Um,
ooh,
and again, at the time, I was like, "Oh, well, that's just the thing that happens." My cousin like pulled it really hard, and it came out. And I thought, "Well, that just happens to anyone if their arm gets pulled really hard."
sure. Yeah. Sounds logical. Yeah.
It's not normal, but yeah. So moving forward, as I got older and I was sitting more, PT school was the worst thing for my health, but also the best thing for my knowledge and how to treat.
That's
I
ironic,
started,
isn't it? Yeah.
it
Everybody
is,
sit for 2 years so we can
uh-huh.
learn how to make people not sit all the time. Yeah. That's
But that's when I started actually developing more of the common symptoms that
sure.
people with hypermobility often deal with.
Yep.
So PMJ disorder, I
Mm,
developed while in PT school because my posture was terrible because of the ergonomics in our sit up in our classrooms.
yeah.
Um, I developed tingling in my hands randomly. I had my back pain come back. I started having neck. like upper cervical pain regularly. And then I graduated PT school and I started working, and then I had 2 pregnancies, and during those pregnancies other things came up,
Yeah.
and I knew that I was at a higher risk, if you want to say that, going into my pregnancies. And so I was as proactive as I knew how to be. And so I do believe that that was very, very helpful. I do not say that to think that you can be proactive enough to prevent all injuries or symptoms during pregnancy. That's definitely not what I'm saying. But I do
Right.
think that anybody who has EDS or any hypermobility syndrome, knowing those same things can decrease their risk for injuries and decrease the amount of symptoms that they deal with during their
Yeah.
pregnancies. That's one
Totally.
thing that I'm really big on advocating for, because women's health has not been treated well in this country as a whole. And
Yeah.
so then having women's health concerns that are also disability related is definitely not adequately educated on.
Yeah, I mean that whole disability and whole that whole thing is just kind of backwards, upside down, and inside out anyway. But I mean, I've had experience with that too. I'm still having experience with that. It's a crazy program. So yeah, anybody that's going through that, I feel you, man. I know what you're going through. But I wanted to throw this out there real quick before you continue with your story, and then we're gonna jump to a break here in a couple minutes, just to talk about a couple sponsors. But my sister-in-law, actually, my wife's brother's wife, her name is Effie Sieverts, and she actually was on the show in season 1, episode 35, I believe. Yes, episode 35 of season 1. She was so if anybody else wants another story that is about EDS and all the crazy that comes with that, hers is an amazing story. So Keely, if you ever want to watch another episode of somebody that you can relate to, it is incredible. So but yeah, that was a fascinating story too, because she had this is like echoing a lot of the stuff that she talked about with what she went through too. So this is actually bringing back a lot of memories of that. So it's fascinating. So yeah, but keep going. We got a couple minutes, and then we're gonna talk about some sponsors here.
Yeah, absolutely. Well, I've almost finished up my story. I was
No,
just
you're
going to
good.
say,
Yeah.
one is that, pardon me, I had been fortunate to only suffer migraine one time in my life until after my first child was born, my first biological baby. I had a very, very high stress event.
Mm.
And my body mechanics were all off still because of just coming out of pregnancy and being postpartum. My hormones were probably still off. And I experienced about a month-long migraine. And um, prior to that, I had known that migraines were bad, but I didn't have full empathy for my patients that suffered migraines, even though it was very, very common. And I would say that that's another thing that is very common with hypermobility and EDS is chronic or repetitive migraines.
Yeah.
And that's probably the last remaining thing that was true painful conditions that I had to work through and learn about. It wasn't until after that that I really started to specialize in bendy people. Prior to that, I was treating pelvic floor, I thought. But it
Sure.
turned out that a lot of the patients who were sent to me, because pelvic floor conditions and EDS or hypermobility syndromes are very closely intertwined, I was
Yep.
actually treating a lot of bendy people already, and I just didn't know it. And I could have done better for them in hindsight had I
Mm.
understood. They understood. They didn't come in knowing, right?
No.
Now I see
No.
those people and I help them know what's going on. But at that point in time, I was still a young clinician. And so I had a couple wonderful patients who I still love dearly, who really helped me understand, because they came in with a wealth of knowledge about their own bodies. And they were able to teach me about mast cell activation syndrome. And then I learned that my husband also had mast cell activation syndrome. And so I went
Wow.
deep down a rabbit hole, learning about that condition and how it doesn't play nicely with, but almost always shows up with hypermobility syndrome. And then
Man.
later, I would say, is when I got a little deeper into POTS and dysautonomia and how all three of those come together. And knowing that has really helped a lot in how I approach my patients and then how I approach this coaching.
Yeah. Well, and I'm so glad you brought up those other with POTS and dysautonomia, because those are also conditions that we have had other amazing guests on with. And so if you seriously, man, that's why I love I love doing. I had no idea this show was going to become this, but 3 years ago, but this has become such a resource for people. And so this episode will as well. I mean, this episode is a great resource. I had an amazing Ashley was my guest talking about POTS and talking about hydrocephalus, and then Effie with the pelvic floor stuff and EDS, and now you're here talking about like echoing a lot of that stuff too. Like, if anybody is watching any episode of this show, like, it's going to help you understand somebody's story that's going through this condition. And so if you or somebody you know or love are going through something, just scan the episodes, man. You'll probably find a story that'll help you. And this is no exception. I love this. This is so cool. So, Keeli, thank you so much for sharing so much. And we're not done yet, but I'll see you in just a minute. We're going to talk about sponsors for just a second. I'm going to take this off. That'll be back. Don't worry, everybody. So that you can get in touch with Keeli. But thank you so much for being here. We'll see you in just a minute. All right, here we go, guys. I want to talk to you about one thing first. That one right there. That's the one. I want to talk to you real quick about something. Honestly, you know what? I kind of stumbled onto it, really. Seriously, it was not like I was not searching for it. I was not like, oh, I wonder what this is all about. Nope. I literally had a guest on with her husband, and they were talking about some health issues they had and how this organization helped them. And I dove in with like head first. I was like, I want to know more. So because if you know me, if you've been watching for a while, you know that I am all about the least invasive thing first. And then we slowly creep towards the more invasive stuff. And if you have to, yes, go to the hospital. That's what they're for. I'm not telling you not to, of course, if you need to go to the hospital and get care, do it. But I like to start with the least invasive thing possible. And so that's why I love Healthy Home, because they've got some really, really thoughtful wellness resources that do just that. They start with such low invasiveness, stuff that supports your body's ability to do what it already knows how to do. Repair, balance hormones, improve circulation, even improve your skin and joints, right? Like all this stuff that if you don't have to go to the hospital for, don't go to the hospital for it. Call this number, and get some information. I've been digging into it a little bit, learning how it works, and it just makes sense. It's nothing crazy. You know me, I'm not the crazy guy that like dives into every, new thing that comes down the pike. If you're even just a little curious, scan the QR code or call this number, and a very nice young woman will pick up the phone and she can answer all the questions that you have. And then she can walk you through the website and kind of show how it works. And it's really cool. So just check it out. And I know you'll be happy that you did. So, and then one other thing that I do want to talk to you about is, nope, that's not it. Nope. Where'd it go? Come on, button pusher. There we go. Welcome to live TV, everybody. The hamster in the hamster wheel didn't push the right button. Hydro with Hope. Hydro with Hope is our nonprofit. I was born with a condition called hydrocephalus. We named the nonprofit Hydro with Hope because hydrocephalus is a mouthful. So Hydro with Hope is there for practical resources, practical things where you know, things like, I'm not into like research and development and stuff. I'm into, I want to give the family a hug that just found out their kid's going to have brain surgery again for the 12th time, right? To treat this crazy condition. I'm the one that wants to get that resource in their hand so that they can have a better visit with their doctor. And the resource I'm talking about is this right here. This book. It's called My Hydro Warrior Story. And it's about 150 pages, and it will walk you through everything that you need to know and that you need to record, so that when you go to that doctor appointment after surgery, you're not left with your hat in your hand and you forgot all the questions you wanted to ask them. They're all right here. Plus, there's some really fun stuff in there about, you know, putting pictures, like pictures of your hospital room that you stayed in, or pictures of your post-surgery crazy hair. Man, you get some. The last surgery I had some serious flock of seagulls hair going. It was pretty impressive. In fact, one of the pictures I think is in the intro to the show. That was for that flock of seagulls hair. So go back and watch it. It's pretty funny looking hair you get from this. But all of that is a part of hydrocephalus, and so I want to support all of that. And so this is actually a donation link. So if you ever want to donate to the cause, that's the best place to do it. So all right, let's bring Keeli back on here, and thank you for your support. And thank you for watching. We're so excited that you're here. There she is. Let's keep going, man. This is all good. This is, like I said, I'm kind of flashing back to that episode with Effie, but this is like refresher of a lot of stuff. It's really cool. So, but let's talk about some practical stuff, man. You talked about, you kind of threw POTS in there without really talking too much about it. So what is POTS, by the way? Is that for those that are not familiar?
I can get into that. I really was hoping, though, that we could segue into what is the Bendy Dizzy Institute program.
Oh, 100%. Yes, let's do that first. Yeah, let's talk about that. I just thought, you know, POTS is another one of those acronyms that nobody knows what it is.
Yes, we're going to bring that up.
Let's do it.
Just realized we set ourselves up beautifully for this transition, because where we left off was at the end of, you know, me dealing with my symptoms, which I recognize are relatively low compared to a lot of people who have EDS. Probably your, you said it was your
sister-in-law. Yeah.
Sister-in-law. Sorry. Sorry. And in my practice, what happened is, as I started treating a lot of people with these conditions, I started hearing my story and where it branched. You know, it was the mom who came in and said, I was fine, I was healthy, I was athletic, and then this happened, right? Yeah. Or the young girl who was fine, who was healthy, and then this happened. I could see all the points at which my life could have taken a turn, where I could have ended up bedridden, unable to work, and really struggling financially, emotionally, etc. And I became so grateful for the abilities that I do have, even though I may think about it every day and manage how I hold my body and do things to maintain that. I realized it's really a privilege that I happened to have the information that I needed to allow me to manage my conditions so well that I didn't even realize I had some of it. So yeah. I say that not to minimize people who have mast cell activation syndrome and POTS, because I'm not claiming to have those diagnoses. What I am saying is that I have learned that just about anybody who has hypermobility will express some of the symptoms that are related to those conditions, whether it's POTS per se, or it's some type of dysautonomia, or it's mast cell activation, or some amount of histamine intolerance. And so I had been unintentionally managing my histamine intolerance because I had such terrible allergies. I was just treating my allergies by taking Zyrtec twice a day and this nasal spray and this, you know, I was doing a bunch and thought that was just what people with allergies did. And I was managing my POTS symptoms by just having good deep core coordination, which I developed as a pelvic floor PT and was teaching every single day. And I could see how my patients who looked like me but didn't have that piece were having more symptoms. The people who hadn't learned how to manage their stress well. Did I have stress? Yes. Do I have anxiety? Absolutely. I only have learned how to internalize less of it over the years as I've had
Yes.
things come up. So, as I was considering, because of our broken healthcare system, leaving practicing as a physical therapist,
Hmm.
I started thinking about how can I keep working with these patients who I care about. You know, their stories resonate with me. I'm
Hmm.
good at. I don't want to step away and leave one less provider who gives a poop on BPC, because I don't know what your rules are here, but
Thank you.
about them as people, right? Not
Yeah.
just as. And
Yeah.
so I decided to launch this program as a way to, at the very least, help guide people and help give them, honestly, 80% of what I do as a PT for these patients that fall into the spectrum is
Hmm.
education. And I felt like the education is what allowed me to be where I am, at least 80%, right? Of what was going on. And so I
Yeah.
said, well, I can do that. That isn't going to burn me out. That's going to fill me up, and that's going to continue to help me. So that is what Bendy, Dizzy, and Itchy is. It's a lot of what PT looks like, but without skilled PT. We're not having to go through insurance. You're not having to wait 3 months to get in to be seen. You're not going to be asked to do exercises that are going to increase your pain, or have somebody put hands on you that doesn't know what they're doing and therefore can actually cause you pain. You're going to
Yes.
learn what you need to know so that if you need APT, which I still believe that most, if not all, people in the world, but especially bendy people, need a PT. Then you know when you go in for that first session what things you want to hear from your provider to make you feel comfortable that that's a good fit. You know
Hmm.
how to ask the right questions to make sure that they're not going to intentionally or unintentionally do you damage, right? And you're going to learn where you need to advocate for yourself and say, hey, that doesn't really work well for my body. Can we try a different? You're going to learn how to advocate for yourself and what tools you can bring with you to help that provider not get defensive, right? Because
Yep.
that does happen, right?
Yeah. Totally.
Unfortunately, it shouldn't. But often people do one of two things. And by people, I mean providers. They will either say, I am uninformed about this, therefore I won't see you. Or
Okay.
they will not admit that they are uninformed about it, and they will proceed as if you are a regular person
That's
and
worse.
potentially,
That seems
right.
worse. Yeah. Yeah.
It should, because either one is good, right?
Yeah.
And yeah, I would say it's worse by, by the lack of access is also a problem. So
Yeah.
with this
Yeah.
program, there's the I want to help inform you so you can be a more informed consumer. Um, and I also want to inform your PT. So I recognize that there are a lack of PTs who feel comfortable or are knowledgeable in how to modify their treatments to make them safe for bendy people. I don't believe that the majority of those people don't want to. I think that they're either overwhelmed and don't feel like they have time to learn, or they don't have the resources to go take more continuing education on it. But the most of them are likely willing to learn that information if they have the opportunity and it's easily accessible. So
Sure.
what I'm offering as a part of this program is, if you find a PT in your area, and or I'd love it if PTs were referring to the program, and we can create a wonderful collaborative effort.
Mhm.
But uh, if they're treating you, they can come every Friday. I'm going to hold a lunch and learn
Nice.
where people can zoom in, they can ask specific questions with no patient identifiers, and we can talk as clinicians about how do we better serve this population. I will be prepared to talk on specific topics, but if there's not a question, or if there's not a question, but if there are specific questions, then that's what we'll go over.
Sure.
And my hope is that that allows people to get the care that they need where they are and know how to be informed consumers and advocate and treat themselves. There's a lot of stuff you can do for yourself if you just have the right toolkit. So part of this
Yeah.
is giving you the tools that you can use on yourself, right?
Mm-hmm.
Most of it's available on Amazon.
Hold on one second. I remember we were going to talk about your nonprofit, Health for the People, and I don't want this episode to go go past us without touching on that a little more. So let's talk about that, and then we can kind of dive into whatever else we want to talk about. So, Health for the People, what's that all about?
Yeah, so people might be wondering, like, how is the nonprofit connected with this program? And so Health for the People is an organization with dual missions. They are to include all voices when we have a conversation about healthcare reform, which includes people with invisible disabilities, as well as racial, gender, and any other differences, as well as to help the people who are falling through the cracks of the currently very broken healthcare system to increase access, right? So this falls into that access side of things. And it's all run through the nonprofit, Bendy, Dizzy, and Itchy is. And so the beautiful thing about that is every dollar that you put into this coaching program, 6% of that goes into a fund that helps increase access for other people who need not only like this information, but hard time accessing healthcare where they are. Our organization is based out of based out of North Carolina, and so currently that's the way that it's set up is primarily through North Carolina, but we're working on expanding that and changing the criteria. And yeah, so if you're also interested in healthcare reform and you want to have your voice heard on that topic, please reach out to me. We need volunteers, we need some board members. If you're passionate about that, also reach out to me, but we won't take a lot of time.
Speaking of that, there's actually an organization. Remind me about that when we get done here today, because there's actually an organization that I don't want to just derail our conversation, but there is an organization that I want to refer you to that you might find very helpful as well. So let's talk about that after. But love it. Health for the People. It sounds incredible, and I love that you're automatically donating there every time somebody works with you. That's amazing. So is there a place where is there anywhere on this QR code here that or anywhere that would lead to that people could donate? Or
absolutely. So if you follow the QR code, it's going to take you to the Bendy, Dizzy, and Itchy page, but it's part of the Health for the People website. Nice. So click on any of the other tabs, or up at the top right, I believe, is the donate button. There's lots of different ways to give your money.
Perfect. I love it. Now, just we got about 8 or 10 minutes left here, about 8-9 minutes left before we're finished for today, and I want to make sure that we talk about if somebody is listening or watching right now, anybody that's out there, wherever you're watching, again, this is a really good place to comment. If you're on Facebook and YouTube, this would be a perfect time to chime in here if you're in this boat. But if you met somebody online or walking down the street or whatever, and they what would be the thing that if they said this, I would know that I needed to help them and I could do this? Like what's the progression there?
Well, I would say there's a few different things. So back to the name of the program, Bendy, Dizzy, and Itchy, right? So I'll give you one for each. If someone, most of the time people don't tell me that they're hypermobile, I see it from a mile away because I'm a trained guy and I live in the box. It's a little easier for me to spot. And I sometimes do just give unsolicited advice because I can't. But the number one thing I tell people when I see that they're hypermobile is, hey, just so you know, if you're not dealing with any pain, that's awesome. But being hypermobile can sometimes lead to musculoskeletal pain. And if that comes up for you, you should try to find a PT in your area who is on the EDS Society website, knows what they're doing for hypermobile people. Or if you can't find that, find a pelvic PT because they generally are a little bit better suited to treat those conditions because they're used to treating women who are pregnant and postpartum who are inherently hypermobile.
Nice.
So yeah, that's my like little 5 cent spiel on that, because there's so much that you can't really like give all of the advice all at once.
No.
Um,
Sure. Yeah.
but I would say that, and then I would also, if I had a little bit more time, talk about posture, because it is one of
Mm,
those things that may not be super important for everybody in the world, but I will say for people who are hypermobile, posture is way important. Because if you can use, and that doesn't mean it always has to be unsupported posture where you're using your muscles, because that gets exhausting,
yes.
but using good sitting posture and good standing posture, and knowing how to use sports when necessary, and sitting, standing, and walking
Hmm.
will go a long. Um, One fun thing you can do with that is you can put something weighted, so people make a sock with some rice in it, and make yourself a little like sandbag type thing. Put it on top of your head, and then practice just standing with that weight, because it gives you feedback. And what we lack as bendy people is proprioception. We don't understand where we end and where the rest of it begins. And so having that proprioceptive input goes a long way for helping you know where you are and how to improve.
Cool.
So second bucket would be the dizzy part. Now, you asked me to define POTS earlier, and I'm going to define it. But when I say dizzy, um, I mean POTS or dysautonomia, which sometimes shows up or is described as being dizzy.
Hmm.
POTS stands for postural tachycardia syndrome, which means that you stand up and you were feeling fine, maybe sitting. When you stand up, all of a sudden you get dizzy, you may faint.
Hmm.
And that's because when you stand up, all the blood rushes from your brain into your lower extremities. And then the lack of oxygen in your brain makes your vagus nerve tell your heart, hey, whoa, danger. And then your heart goes, we got to pump
Oh.
overtime to get the blood to the brain, because that's number one necessary, right?
Yep.
And if it can't do that, then timber. Um,
Yeah.
so it's your
Yikes.
body trying to compensate for the lack of blood flow in your brain by
Yeah.
increasing how fast it pumps, but that increasing how fast it pumps makes you feel anxious.
Mm,
um, and
sure.
it sometimes people don't actually pass out, they're what we call pre-syncope, which means you may like have like a curtain, like you don't see things for a minute. It gets a little darker. You get some
Hmm.
stars around the edges, and then
Mm,
you sit down, and then you feel okay. That's pre-syncope. That's a warning sign. That's something you should be addressing, and not just kind of like, that was interesting.
yeah. Yeah.
Um, and it's not always POTS, right? Sometimes there are other types of dysautonomia that show up.
Sure.
And
Sure.
what dysautonomia means is your autonomic nervous system is dysfunctional,
Yep.
right? Dysautonomia. So your autonomic nervous system connects to, like, your vagus nerve is kind of the super highway of your autonomic nervous system.
Yep.
There's more to it than that, but you'll hear a lot of information about vagus nerve. And so my one little takeaway that I'm going to have everybody try today, because you can do it for free and in real time with us, is what we call an ear pull. So if you feel, let's say you're not necessarily like blackout, because then you should sit down and maybe get your legs in.
Yep. And we
Um,
got we got about 4 minutes to go. So
okay, we
yeah,
got it.
we got it.
So if you're feeling particularly stressed, because stress levels play into your autonomic nervous system, whether you're stuck in fight or flight or feeling like you can be in rest and digest, and
Yep.
that goes along with whether your heart's going to race. You can put
Mhm.
your fingers in your ear loop there. I have a headphone on the side, so I have to pretend. And you're going to pull both sides down, moderate pressure. There's no right or wrong. And you're just going to hold that. You saw me twitch, because that's how my body tells me that I am entering my parasympathetic nervous system, that I'm downshifting, and that I'm better regulating. A lot of people have an involuntary swallow, or possibly a yawn is a little tell, if you will, that like,
Okay.
hey, that was good, you did enough. Otherwise, if you're not sure, you're going to sense for a sensation of a downshifting for about 30 seconds. If you don't know, just go, okay, well, it's been about 30 seconds, so I'm good. and see if you can't tell that you feel better regulated after doing it.
Nice.
That's just one of the many, many vagus nerve hacks that I teach people, and we figure out which one works well for you. Not every one works for every person.
Right.
And then
Yeah.
the last bucket, really quick, is itchy, right? So mast cell activation syndrome is a mouthful. Um, but basically it means that part of your immune system, your mast cells, are overreactive to normal triggers. So where I may have grass is one of my big triggers because I have an allergic reaction to grass, but then my autonomic or my nervous, Lord have mercy, my immune system is going to over respond to that, and it can lead to itchiness and hives and feeling flushed, and then causing my autonomic nervous system, my POTC side of me, to also overreact. So they feed into each other in a yucky feedback loop.
Yeah.
And that's often why people fail PT, is actually because of the POTC and the mast cell part getting in the way of them being able to tolerate the treatment that they need from PT.
Yeah.
Wow. So basics for that are things to address histamine. So the first thing they'll do is put you on an antihistamine if you go to an allergist and they actually believe you. And then there are other ways to help address histamine intolerance from different perspectives. And so I help people start to learn what are your triggers, what things are working for you, what doctors might you need to go to get more feedback and information on how you can manage that piece well. So then you can actually get out of PT or out of your home strengthening what you want.
Beautiful. Man. Whew, sorry, I had to take a deep breath there for a second. That was a lot.
Sorry, I get a little, it was like 4 minutes, you gotta get it all in there.
That was a lot. I feel like my hair just singed or something. It was on fire for a second. No, that was awesome.
But I would say I talk a lot in our coaching sessions too, because I want to get you all the information. So one nice thing is that I'm able to get the transcription and the breakdown of what we went over and send that to my clients too, so they don't walk around going
right. Oh man, no, I totally get it. I so appreciate that. But we are out of time. So Keeli, good Lord, that was so much amazing information. Thank you for being so amazingly real and just honest with your story. And I mean, because this is a big deal and there's so many people that are dealing with it. So thank you for being here and to tell your story and to give us so much incredible information. Thank you so much.
Thank you. I really appreciate you giving me this platform, and I hope that I can help some more people thanks to your platform and your audience.
I appreciate it. Thank you so much. Awesome. All right, man, everybody, I tell you what, and by the way, I didn't say this before. I want to throw this in there real quick. Keeli and I actually met a few days ago before we were here to talk to all of you amazing people, and she was helping me in a session with vagus nerve stuff, because that's the brain surgery I had in 2021 kind of wreaked havoc on that. So she was helping me with a little bit of that. So just go talk to her. She's awesome. So, all right, everybody, we are out of time. So thank you so much for being here. Like, follow, subscribe, share, all the things. Thank you for being here. Thank you for being here for everything. If you've been here since the beginning, we love you so much. Thank you. And if you're brand new, we love you too. Thank you for being here too. Join us for our next episode, which will be Friday, March 13th. And until then, have an amazing day, and we'll see you next time.